Welcome to Bariatric Makeovers. I'm Dr. Hanna here at Las Vegas Bariatrics, and we'll be talking about weight loss surgery and the journey that our patients go through after bariatric surgery. My guest today is Sue. Welcome, Sue. How are you today?
I'm good, thank you.
Excellent, great. It's so good to see you. You look lovely.
Thank you very much.
You're quite welcome. So tell me, we first met about a year ago, right?
It was in July, actually, so it's about a year, almost a year and a half now.
Great, and look at you now.
And look at me now.
Yeah. What inspired you to come to Las Vegas Bariatrics and see me and consider weight loss surgery?
Well, I had my primary care doctor asked me at a certain point when I was really having a lot of pain issues if I had ever considered bariatric surgery, and I told her that I had thought about it, but I didn't think that that I could have it, and I didn't think my insurance would cover it. That was one of the issues for me. And she said, I think they will. I have a couple of other patients that are going to Dr. Hanna, and they have the same plan as you. So she said, do you want me to send a referral? And I said, well, let me call them, make sure, and then I'll call you tomorrow. So I called, and they said, yep. And so I called her, and I said, I'll have you send that referral now. And so she did, and I came to see you within a week or so after that.
Okay, great.
Because I had reached a point at that time of really having a lot of pain issues, my hips, my knees. I was using a walker and a cane, and my kids had just bought a wheelchair.
Oh, wow.
Because they wanted to get me out of the house more because I was becoming a recluse. I was staying home because I was uncomfortable going anywhere. I couldn't have any fun. It was just really an issue where I was becoming very reclusive. So they said, well, if we get the wheelchair, then if we want to go somewhere, or if you want to go shopping with my daughters, we'll put you in the wheelchair, and then you don't have to walk, because I couldn't walk for more than 5 minutes at a time without sitting down.
Gee, so that was really a huge eye-opening event for you then,
it was.
Considering the life in a wheelchair.
I know.
So what was your weight at that time?
I started off at about 241, I think, when I started with you.
Okay.
The highest I've ever been in my whole life, ever. And I've been a yo-yo dieter all my life. Mm-hmm. I'm a compulsive eater, have always been a compulsive eater. I can remember when I was 13 years old. I can remember that was the first recollection in my mind when somebody asked me, and I think it was on the evaluation that I had to fill out the psychological thing, the 14 pages that I had to fill out to see if I was crazy or not, or if I had the right motivation.
Sure.
And I remember they asked that question, and
right.
I remember distinctly when that happened, and I was 13 years old. I was
Wow.
babysitting for somebody who had a half-gallon of ice cream in her freezer, and when her boys went to sleep, I ate what was left. There was about a fourth of it gone.
Yeah.
Then I had to go out the next day, and I remember I had to buy the exact same ice cream, and I had to eat it down to where it was before, so that she wouldn't know. Yeah, I mean and I was 13 years old.
Oh, gee.
And then it was like that my whole life.
The beginning of quite a lifestyle. Huh?
Yeah, right. And I've been very thin, and I've been very heavy, but the most weight I ever carried was 250 pounds.
And currently, what's your weight?
I am at 151.
Okay,
so I'm 10 pounds. I wanted to lose 100.
Yes.
I'm down 92 pounds actually.
That's excellent.
And I wanted to lose 100, but everybody keeps saying, I don't think you need to lose 100.
Sure.
You're thin enough. But I think I would like to just to be able to meet that goal, and then if I want to fudge a little bit, I can do that. But
yes.
I think I'm very close to my goal.
So it took a lot of courage to come here and decide on surgery as a solution for weight loss. So tell me about that experience going through the surgery.
I thought the surgery was a piece of cake. I mean, really, it was not difficult at all. I mean, it was over so quickly. I remember you coming into the prep room,
right.
And then I remember waking up in in the room, and I said to my daughter, how long was I in there? And she said like 30 minutes or something like that.
Gee.
And I had to stay in the hospital for one night because
Sure.
the surgery or the insurance insists on you doing that.
Right.
And they were really great at the hospital. They had a great staff there. That's kind of their specialty in that department, and it's wonderful. But I had no side effects. Some of the side effects that people had kind of warned me about, I didn't have at all. I had no nausea. I didn't have any of the things that I was expecting. So I was expecting worse than it was, and I had no pain of any kind.
Right.
I was shocked at how little the the surgical thing was. I mean, how like the scars, you can't even see them. They're so tiny.
So you're my ideal patient.
I mean, really, it was nothing at all. I mean,
So
and
that's
I
great.
didn't have any problem. Well, because I think you didn't want to do, I don't know, you talked to so many people, and when I first came in, you looked at my age, because I was 77 now, I'm 78 now.
Incredible, right?
And you said that you really, that usually that age was a little bit higher than the norm. And
Sure.
I said, I really want to do this.
Sure.
And you said to me, let's see how you do before the surgery.
Right.
So in July I started. I went home that day with that menu plan, and I had seen the dietitian,
Sure.
and she gave me a protein shake that I liked, and I took one in the morning and one at night and started eating a very small portion of something at lunchtime.
Right.
By the time you were ready to have the surgery, it was January 31st I had
Right.
the surgery. And I had lost 45 pounds all by myself.
Amazing, huh?
And so I think you were convinced that I was serious about this business, and
Right.
that I wasn't going to be a flake and not do the things that I had to do. I think sometimes people, somebody's getting married or somebody's doing this, and they have to be a bridesmaid, and so they
Right.
say, I got to lose 20 pounds. That's not a good reason.
Right. That's a
because
short-term
That's
fix.
a short-term fix.
And this is
And this is a long term. It's the rest
lifelong.
of my life.
Exactly.
It is. The day that I started this program was the first day of the rest of my life. And I know
love it.
that's a cliche,
That
but
is.
it was the
But
absolute.
it's so true.
But it's the absolute truth.
And that's why we're here to support you through that. I always say, you're my patient forever,
I know.
Yeah.
I know. That
So-
doesn't upset me in the least.
Right?
That's great.
Excellent.
I'm very happy that you're happy.
Thank you.
So I developed better habits before I had the surgery to prepare me for what I was going to have to do after the surgery, because I knew
Exactly.
that it was going to be very different from the standpoint of eating and what I could have. And now I could have anything, but I choose not to have it.
And really, that's what we try to teach you here, is the lifestyle, right? I mean, you went through that 4 or 5 months prep, and really all of that is teaching you, training you on how to live your life forever and follow that path so that you succeed and continue to succeed. Because all history shows that the diets, they fail up to 95% of the time. And obviously you've been through these diets.
Oh,
You've
everyone.
Yo-yoing up and down, but it's the consistency and sticking with the plan that's key, right? So your life has really changed for the better, and your choices have really changed, right?
And also the fact that before I couldn't even walk for 5 minutes. Now, Mondays, I have an hour and a half of water yoga.
Oh, wow, that is
Wednesdays
amazing.
and Fridays, I work out in the gym.
Oh.
I got a personal trainer.
I think you're doing better than me.
I got a personal trainer. This was after the 45 pounds, because I
Oh,
knew,
gee.
first of all, I knew my skin was going to get, I had to do
Sure.
something to kind of,
Right.
get myself in shape
Yeah.
so that I wouldn't end up with all this baggy, saggy stuff after I lost all this weight I was sure I was going to lose.
Right.
So I went to the gym. I have a really nice one in our community center, and it's got every kind of equipment, and I talked to the manager, and I said, I need a trainer. He said, I'll do that.
That's
And
awesome.
the first visit, we talked about my pain issues, and we talked about my meds and things like that I was taking. And he put a program together for me where I wouldn't hurt myself, but that would help me get started with exercise again. So I've been doing that since even before the surgery, but now I do it with more intensity. I've added weights, I've added reps, I've added several machines to the ones that he originally gave me. So he's very happy with me. And
I'm happy with you.
And you're happy with me. And that was important because I wanted, I don't know why, because, well, first of all, I like you, but I wanted to be a success for you as well as for me.
Thank you.
Because I think any time that I can be a representative of who you are and who and what your practice is and what can be accomplished for people that need this kind of thing. I think
we so appreciate that because, you know, our nation is in trouble. Literally 2 out of 3 individuals are either overweight or obese. So you're talking millions of people out there who need a revelation and a change in their life for the better. So your experience is going to be put out there to show how success can be achieved using this surgery as a tool. So not only is this surgery a part of this process, but the diet, the exercise, it's a comprehensive lifestyle change, right?
And the support.
And the support. Exactly.
You know, if somebody tries to do this and they don't have any support, or they have enablers, or they have people that are saboteurs.
Oh, definitely.
And saboteurs, you know, I lived with a saboteur for 25 years.
Yeah.
I would lose weight. He would bring home a box of C's candy.
Oh, geez.
I mean, that
C's is good.
That's, yes, yeah. I mean,
That's
he knew
hard.
It really was. Or we take the kids out. I had 5 kids, by the way.
Yeah.
12 grandkids and 13 great grandkids.
Oh.
So, you know,
that's amazing.
It's amazing.
Now you get to enjoy all of them.
And they have all been supportive.
Without a walker.
I know, without a walker.
A wheelchair.
I know. And they're all so supportive. My grandkids and my great-grandkids, everybody. It's like, they call me Lita. I didn't want to be called Grandma because I was too young when I had my first grandchild.
Yeah.
So I'm Lita.
That's
and everybody,
beautiful.
they all call me Lita. So they all say, "Oh, Lita, you look so good. You look so pretty. Oh my gosh, Lita, you lost so much weight." And they're all so supportive. And if a person starts on this journey alone, without any family support or friend support, you need somebody in the process with you. It's a treacherous journey to try and accomplish it by yourself.
It certainly can be.
Because, and especially like me, I'm a widow, I live alone.
Right.
I have nobody to look over me and say, they couldn't say when I saw that Domino's commercial on TV, and I had Domino's on my speed dial.
Right.
At 7 o'clock at night, I would see the Domino's commercial, and I would pick up the phone and dial Domino's, and at 7:30, I'd have a pizza in front of me. And there was nobody to say, "Oh, you really shouldn't eat this late at night," or "You shouldn't even be eating Domino's pizza." Right. But those are the kind of things that you can do when you're by yourself, or when you don't have the support. Yeah. So even though I'm alone, just knowing all of these people are out there that are supporting me. But I had to be there for me too. You have to want to do this for yourself. You can't want to do it for somebody else, especially somebody that could disappoint you.
And that's key.
And it is key, because if you get mad at that person, or you're doing it for somebody, and they do something that upsets you, for me, that would have been a trigger to go and grab the ice cream container out of the freezer. I mean, that would be a trigger for me.
So you have to obey the signals.
Exactly.
This gastric sleeve, it literally makes your stomach 1/3 the size, so you have a small stomach there.
Very small.
Okay, and also with gastric sleeve, your appetite is less.
I have to remind myself to eat. Good. Because I never get hungry.
That's great.
I have to say, okay, it's 8:30 in the morning, better have my shake. Good. And then I do what I'm doing around the house, or I'm out or whatever, and I said, oh, must be lunchtime, because I don't feel like it, but it's the time.
Great.
I have to remind myself to eat. I don't get hungry. I don't get cravings for stuff anymore at all. I used to, when I first started this, I DVR'd everything so that I could, because I had triggers. I mean, like I said, the Domino's pizza commercial, that would trigger that, pick up the phone and quick dial. And
I hope that's off of the speed dial now.
That's the first thing I did in July of that. When I came away from your office, that's the first thing I did, was delete that off my speed dial.
Great.
There were certain things that I knew emotionally that I had to do. And that was one of them. I had to eliminate those kind of things. So I DVR'd everything for a long time. I have the dish hopper, so I can DVR 16 things at one time.
There you go.
Great thing. So I DVR'd everything, and then the commercials would come on, and I'd skip
Speed
past
through.
them. Now I don't do it anymore. I watch those commercials, and I say to myself, Sue, what the heck would you ever have eaten anything like that before?
Yeah.
Why would you ever eaten
Now
that
you could
before?
appreciate that.
And I look at it with a completely different sense of what it is that I'm looking at. It no longer is a trigger. It does nothing like that triggers me. It just makes me upset with myself sometimes that I allowed myself to use those kind of triggers to eat, and that is what it did to me. I hate it. But we didn't talk about my meds either.
Oh, yeah.
I was taking
All the health benefits.
I was taking a pain medication.
Right.
We've cut that in half.
Okay.
I was taking a blood pressure medication.
Okay.
That's been cut in half.
That's amazing.
My cholesterol is even. Interestingly, when I was heavy, I was always low cholesterol, but my cholesterol is now lower than it ever was, and I was always under that 200 thing that you're supposed to be. Now it's even lower than that.
That's great.
So, but the pain issues, no more hip pain of any kind, no more knee pain of any kind. My back is really bad. There's a lot of degenerative arthritis, so that's never going to be good, but still, without the weight, the pain is much, much less. I mean, really, I don't take, I actually cut the pain pills in half rather than take, and they're only 10 milligrams. So I'm still cutting them in half because I don't need them.
That's excellent.
So, I mean, to me, that was a big thing too, was the pain issues and the mobility issues and all of that, all wrapped up into one ugly package for me when I started. And now that's all gone.
Well, this is amazing. I mean, you walked in here today without a walker or a cane, so that's a beautiful thing.
I just offered to lend somebody my wheelchair yesterday.
You can give it away.
Said her mother doesn't go anywhere because she needs a wheelchair. I said, mine's in the garage, you know.
That's great.
You're welcome to it. So, yeah.
Well, I'm so happy for you, Sue.
Oh.
Thank you for coming here today and sharing your story with us.
You're very welcome, and I couldn't have done it without you. I couldn't have done it without you.
And you'll be an inspiration to everyone else.
I hope so.
Thank you.
You're welcome.